the audience and also me, I just want to know what exactly is burnout and how do you define it?
Yeah, so the easiest way to think about burnout is prolonged exhaustion and stress. I would say if our bodies are like a car, we've all driven in cars before, and if the fuel is low in a car, almost about to run out, that's burnout. That's what our bodies are like when we're burning out.
I mean, it's a good example, basically. Also, the audience can relate,
Yeah.
So let's just talk about depression a little bit. As you're, psychologist, how do you normally define depression clinically?
Yeah, so the clinically we use the DSM-5. It's a book for diagnosing people officially with just different clinical mental health diagnoses. And so the biggest difference I would say between depression and burnout, like clinically, like some of the symptoms are the same, but clinically they're going to be manifested differently. I guess in keeping with our car kind of illustration, burnout is when your fuel runs out or is almost empty, but clinical depression would be like something's wrong with the engine and it's either broke down because of a problem with the engine or it's about to break down and the engine's not running correctly. So we can go into a few of the criteria in the DSM-5 for depression. So in terms of the diagnostic criteria for clinical depression, like the main core feature is at least 2 weeks. There's been either persistent, depressed, sad feeling or hopelessness, or 2 weeks of just like a noticeable change in loss of interest in activities and what they're normally doing. There's several other criterias that you have to meet. For instance, lack of sleep or disturbed sleep, inability to concentrate, feeling like dying or self-harm, suicidal ideations, a few other ones as well. So that would be some of the core diagnostic criteria.